Hello, and welcome to the Lewis and Faye Manderson Cancer Center. If you're a new patient soon to begin treatment at our infusion suite, we'd like to let you know what you can expect during your first day of treatment. We understand that this can be overwhelming with so much information to take in, and it's normal to feel a little apprehensive about your day, but we're here for you because no one fights cancer alone. Your infusion appointment is generally the longest, so you should plan to be with us for most of the day. Let us start with some helpful information you need before your first appointment. The day before your first appointment, it's a good idea to stay hydrated. Drink 64 ounces of water or other fluids throughout the day. Eat a light meal before the morning of your treatment. This will help prevent nausea. Snacks and drinks are available in our infusion suite for our patients, but you're welcome to bring your own. Treatments can take several hours, so we recommend you bring items from home to pass the time, such as books, magazines, or other personal electronic devices, and a pair of earbuds. All of our infusion areas have a seat for a family member or friend. We recommend new patients bring someone with them for their first treatment. Some medications can make you feel tired or drowsy, so you may want someone with you to make sure you get home safely. Medical oncology is located on the first floor. If you enter through the Manderson Cancer Center's main entrance, take the elevator to the first floor. If you park in the parking deck on level 1, you can enter through the double doors directly into medical oncology. You will register at the registration desk. Vital signs and weight will be taken. Your chemotherapy doses are based on your weight and your height. Your medical team will use this information to make sure you're receiving the right dose of treatment. You can also have blood drawn for chemotherapy testing. Chemotherapy can alter the blood count, so it's important we have blood test results to determine the appropriate dose of chemotherapy or any other medications you may get before your infusion begins. You can choose to have your blood drawn the day before your treatment to decrease your wait time. Your next step is to meet your care team in an exam room where your provider will review your treatment plan, check blood test results, and order the medications made specifically for you that day. You will then be escorted to the infusion treatment area. Each person's treatment time is unique to their diagnosis and treatment plan, so the time you spend here during your first day can vary. Your nurse will give you a rough estimate of how long your treatment will take prior to your first chemo day. Once you're in the treatment area, our nursing staff will help you get settled and make you feel comfortable. The infusion nurse will guide you through a series of necessary steps before your treatment begins. The infusion nurse will guide you through a series of necessary steps before your treatment starts. Pre-medications or fluids to help with hydration or side effects like nausea may be given about 30 minutes before your treatment begins. If you do not have a port, the nurse will start an IV to administer your medications. Your nurse will provide you with a welcome packet and will go over all the contents with you. This packet contains information such as how to contact the clinic, a list of medications you will be given, and how to manage side effects. Chemotherapy medications are made specific to you every time you visit, so they cannot be prepared ahead of time. While you may feel that during your wait time is long, our pharmacy and nurses staff are working together behind the scenes to prepare your medication for infusions. Our pharmacist prepares your chemotherapy medications in a sterile environment while your infusion team prepares you for your treatment. After your medication is prepared, it is checked by 2 pharmacists and 2 nurses for your safety. Chemotherapy is scheduled in cycles. Your physician determines the number of cycles you need to receive. The day you receive your treatment is called your chemo day, and the day you do not receive treatment is called your rest day. Your first day of treatment is the beginning of a cycle. Your nurse will go over common side effects, which can include fatigue, nausea, constipation, diarrhea, headache, mouth sores, hair loss, and lack of energy. You will be given some handouts that provide more detail. Most patients don't feel sick when their infusion begins, but if you do, let your nurse know right away. After your treatment is finished, you may need to stay for a short observation and to make sure you feel okay. Your nurse will let you know if you need to be observed. Every patient is different, so we encourage our patients to take notes on how they feel in the days following their treatments. Some side effects may be more important to you than they are to other patients. Having a record of your symptoms helps your doctor or nurse make personalized recommendations on how you can feel better throughout your treatment. After treatment, make sure to pick up any prescribed medications from the pharmacy. This will include your anti-nausea medication. You can take this medication as prescribed for any nausea after your treatment. If it is not working, please call us. For your convenience, we can fill your prescribed medications at our DCH pharmacy, and the medications can be delivered to your chair site while you are receiving treatment. When you get home, it is a good idea to have a light meal for lunch and dinner and get some rest. Our goal is to stay on top of your symptoms. If you have questions or do not feel well, you can call us anytime, 7 days a week, 24 hours a day. We're always here to answer your questions. Before you leave, the chemo scheduler will come to your chair site and schedule your future treatment appointments. Your nurse will review all potential side effects with you and let you know exactly what to expect at home, as well as what steps to take if you do have side effects. Make sure you have a list of your future appointments, the doctor's phone number, and the clinic after hours number. If you have questions and need to call us, we have nurses who know about your treatment plan and can answer your questions. Receiving care in the infusion suite at the Manderson Cancer Center is an important part of your treatment. Your care team will help you manage your health while providing the treatment you need. We hope that this video has helped you understand what to expect, how to prepare, and answered some of the most common questions we receive from patients. The staff at the Manderson Cancer Center thanks you for allowing us to provide care for you.